So the next speaker is Nicoline Post. She is a PhD student at the Amsterdam University, UMC Amsterdam University Hospital in the Netherlands, and she will give a talk about the Meek micrografting technique. It's a novel surgical technique for the treatment of depigmentations. Please.
Hi everyone, my name is Nicoline Post. I am a PhD candidate at the Amsterdam University Medical Centers in the Netherlands, and I would like to thank you for letting me introduce the Meek micrografting technique as a novel surgical technique for the treatment of depigmentation. These are the topics that I would like to present to you today, and regarding conflicts of interest, the device was provided free of charge. To date, several surgical methods of autologous skin transplantation are available for treating stable depigmented lesions to achieve repigmentation. As visible in the table, current grafting techniques lack the capacity of easily treating large depigmented areas with high success rates and low costs. Thus, there is an unmet need for a simple, reliable, and effective transplantation technique for large areas. This year, Narayan et al. Published a systematic review about donor-to-recipient ratios in the surgical treatment of vitiligo and pybaldism. A total of 31 studies were included with 1,591 patients. 2 randomized controlled trials directly compared expansion ratios in non-cultured cell suspension transplantation and demonstrate that significantly more patients achieved more than 75% repigmentation in the lower expansion ratio group compared to the high expansion ratio groups. Moreover, when we look at the pooled analysis of the percentage of lesions that reached more than 50% repigmentation, we see that the 1 in 3 expansion ratio has the highest success rate of 89%. The percentage is decreasing when the expansion ratio is higher. Even so, the chi-square test showed a significant difference between the groups. We can see the exact same kind of table for lesions that achieved a repigmentation rate of more than 75%, with, again, a significant difference within the groups. Now I would like to introduce the Meek micrografting method. Currently, this method is a milestone in the history of acute burn surgery. However, this technique has never been utilized previously in the treatment of depigmented lesions. We use this method to give 10 treatments in a total of 6 patients with stable non-segmental vitiligo and pybaldism. During the procedure, we harvested a 200 micrometer split thickness skin graft from non-lesional normally pigmented skin of the hip using an electric dermatome from Humeka. After that, the harvested skin was placed onto square cork plates and cut into 196 small square pieces per cork plate, measuring 3 by 3 millimeter using the Meek micro measure from Humeka. Subsequently, the micro skin grafts on the cork plates were transferred onto a pre-folded expandable gauze with an adhesive spray, and the square cork was gently removed. The gauze, now containing the skin pieces, was manually unfolded, allowing up to a 9-fold skin expansion. The recipient site was prepared with a carbon dioxide laser, ablating 209 micrometer of tissue, followed by fixation of the expanded gauzes and the laser ablated site. Finally, the Meek gauzes and dressing were removed after 1 week, and patients were seen after 6 and 24 weeks. During the hospital visit, photographs were taken from the recipient site in order to measure the repigmentation rates by image chain. In total, 10 treatment sites with different expansion ratios were treated. After 24 weeks, the repigmentation rate was measured in 9 treatment sites and showed a mean repigmentation rate of 77%. 5 of the 6 patients were also previously treated with punch grafts. After a minimum of 24 weeks, these treatment sites showed a mean repigmentation rate of 65%, lower than the repigmentation rate achieved by the Meek micrografting technique. The mean repigmentation ratios according to the expansion factor were also measured. Although sample sizes are very small, after 24 weeks the 1 in 3 expansion rate has the highest success rate of 91%. After 6 months, patients were asked to fill in a survey about their treatment experience. patients responded to be satisfied to very satisfied with the treatment, and all patients would recommend the treatment. Moreover, patients noted that repigmentation was visible after a mean of 2.4 months, and more than 75% of repigmentation was seen by patients after a mean of 4.4 months. After the treatment, their vitiligo was a lot less noticeable, up to not noticeable, and color match was good to excellent. The results of the Meek micrografting was better to much better compared to the results of the punch grafts, according to the patients. Our take-home messages. The Meek micrografting technique achieves high mean repigmentation ratios and comparable results for expansion ratios of 1 in 3, 1 in 4, and 1 in 6. Moreover, patients are highly satisfied by the results of the treatment. Outcome depends on many variables, including the indication of the treatment, the stability of the disease, the location of the depigmentation, donor-recipient ratio, and UV exposure. A special thanks to the team and my promoter and the participating patients of this study. I'd be glad to answer any questions that you might have. Thank you very much for your attention.
Thank you very much, Nicoline. This was very interesting. I did not see any questions so far, but maybe I can give you a question from my side. If you compare this to the non-cultured cellular grafting technique, can you explain in what the advantages in your view? Sorry, you have to unmute yourself.
I think that the advantage could really be that once the Meek micrografting is already bought, then the procedure is not that expensive anymore. So compared to the cellular grafts, it's a lot less expensive, and we can achieve good rates of repigmentation comparable with the cellular grafts, I think, yeah.
Do you have also some results with color match? Do you hear me? Sorry, we can't hear you.
I think you can hear me now, right? Yeah, okay. Yeah, so personally, we didn't do a color match testing ourselves, but we asked the patients how well they think the color is matching, and they all said that the color match is good to excellent. So we're really, yeah, very glad with these results.
Yes, and also on the long term, did you do evaluations on the long term?
Yeah, especially on the long term. In the beginning, we could see that there were a few patients with a little bit of hyperpigmentation, and after a few months, this results in a completely normal repigmentation.
Okay, thanks. Do you consider this as a variant of split thickness grafting?
I'm sorry, I couldn't hear your question completely.
There is an echo, I know. Do you consider this as a variant of split thickness grafting or more like punch grafting?
I think this is more comparable with split skin grafting, especially because we can reach a lot better expansion ratios compared to the punch grafting.
Thank you. I can see that there is a question from Samia. Please, Samia.
Yes, yes. I thank you for the presentation. I wanted to know, did you try this in the areas that are difficult to repigment after the punch grafting and the suspension grafts? I mean, the elbows, the lips, the knees, the fingers. Did you try that?
Yes, so the treatments we've been giving right now are mostly on the legs and also around the hip area. So there are some folds of the skin where we've been treating, and we also see, unfortunately, that the results are there less than on non-folding skin. So perhaps in the future for the elbows, it could be difficult to achieve these high repigmentation rates as well.
Yes, all right. Thank you.
Thank you. I think we can continue now with the next speaker. Thank you, Nicoline.